And our next question is going to be a little bit about gestational surrogacy. So what is gestational surrogacy? When is gestational surrogacy medically recommended? What medical conditions can lead to discuss this option?
Yeah. Again, so surrogacy is going to happen for some people who just there's no uterus in the family, right? Meaning that, there's somebody who and this can be either a gay male couple, a single dad by choice, same thing, no uterus there, or a female who doesn't have one. She's had her uterus removed or never had one to start with, which is really rare, but sometimes possible.
Mhm.
Um, Other people can reach that sometimes from, again, that same sort of trial and error, meaning they have attempted and had multiple failed implantations, and that's been recommended. Um, other people who might go straight there is somebody who has complex medical conditions, right? They've never tried to conceive. They're not reaching that place from sort of failed chances of embryos sticking in their uterus, but they have a medical complication that puts them at risk if they were pregnant or puts the pregnancy at risk. And there's many things that fit into that category, and it can be anything from like they're dependent on a medication that's not safe in pregnancy. They
Mhm.
themselves have a history of, blood clotting or, because it's always in many of these medical conditions, you're still sort of weighing the pros and cons, right?
Right.
Because most of the time, even in the setting of a sort of medical complexity with the appropriate medical management, it's still a choice to carry on your own, but somebody may not want to try that. So, you know, um, but anyway, it's often some sort of medical complication or a previous pregnancy history. I have a patient who had a seizure, or she had eclampsia in her third trimester. She had a seizure at home, and she did not want to carry another pregnancy, and she's at increased risk for that happening again in the future.
Right.
Or a patient who's had premature rupture of membranes at 28 weeks, and so a prior poor pregnancy outcome is another reason that sometimes people reach surrogacy.
Yeah, thank you for explaining that. And on here it also says repeated thin lining. So if
Mm,
this is something that you could also
yes, this
comment where it
is,
fits into decision making.
yeah, this is a hard one. Thin linings are hard. They're so hard because they're a hard thing to fix. And there's two kinds of thin linings. Sometimes it's a thin lining from prior instrumentation. That person has had multiple DNCs or some sort of prior instrumentation of the uterus that's led to that. And
Mhm.
sometimes they're just thin and you never really figure out why. Um, they're hard to fix in both instances. Um, the truth is that this is always an individual decision, a decision to be made between any given individual and their provider, because you can transfer an embryo into a lining that is less than 7 millimeters, and you can get pregnancies. I've had many pregnancies from linings that are less than 7 millimeters.
Mhm.
There's probably a threshold level of thinness upon which it's really unlikely. Is that 4 millimeters or five? I don't think anybody knows for certain. And in that in between range, you have to decide if you want to try, knowing that the chances for implantation are lower but not zero. And there may be somebody who is not okay with that, and that could be a reason to move forward with a surrogate.
Awesome. Thank you for explaining that. Yeah, that's great to know. All right, question number 10. So many intended parents wonder about this. Can patients with low ovarian reserve or other abnormal fertility tests results still pursue surrogacy if they are able to create a healthy embryo?
Of course. Yeah, the goal, right? The thing that you need
Yes.
to use a surrogate is an embryo.
Right.
Right? And there's many ways to get to that embryo. And some people generate five embryos in a single cycle, and some people do five cycles to generate one normal embryo, right? Everybody's journey is a little bit different. But if you can get to that normal embryo, absolutely you're a surrogate or a candidate to use a surrogate if you
Mhm.
have a reason to do that. And it is true that with lower egg numbers, sometimes it is harder to generate a normal embryo. So you have low reserve. What does that mean? It means your basket's on the low side. That
Mhm.
means if you do an IVF cycle, which essentially what you're doing is reaching into the basket for a group of balls, right? If you
Mhm.
grab three, you're going to be less likely to grab a green than if you grab 10.
Right.
But it doesn't mean you can't grab three and get a normal embryo. It happens all the time. So it does make it harder when you have low egg numbers and you're getting smaller number of eggs in each given attempt. But as soon as you get to that normal embryo, and I do think that almost all the time when we're using a surrogate, we are using PGTA, that testing we just discussed, again, so that you are identifying the embryo that has that highest chance of implantation. If you're going to go through all of the work and coordination and cost to use a surrogate, you want to identify an embryo that has a high chance of sticking and a low chance of miscarriage.
Yeah, definitely. Thank you for addressing that. All right, question number 11. So receiving abnormal fertility test results can be emotionally overwhelming.
Mhm.
So what advice would you give patients who are trying to understand their options and decide on their next steps?
Oh gosh, I think that's two questions to me, or two thoughts anyway.
Yeah.
The sort of the discouraging aspect, the emotional aspect of it starts at the moment of receiving results and often continues much beyond that. Okay.
Mhm.
So it is very hard to receive abnormal results and it doesn't always get it's just hard, right?
Yeah.
So that is a good moment to immediately start making your support network as robust as possible, right?
Mhm.
Because it's not gonna be just easy from there. It's a roller coaster. And the roller coaster is like throughout. The whole journey can be a roller coaster. The 5 days after your egg retrieval or sometimes it's like a mini roller coaster on a big roller coaster.
Yeah.
So I think my advice in that is to what makes you feel supported? Is it going to one of these webinars? Is it finding a support group? Is it a Facebook chat group? Is it therapy? Is it acupuncture? Are you gonna, go to Inside LA and take a meditation course? Like, what are you gonna do so that you can keep putting one foot in front of the other to you achieve your goal? And some people achieve their goal in 3 months, and some people I've been seeing for 5 years and you don't really know which one you're going to be when you start. So that is my advice around the discouragement part. And I do not think it ends with the reviewing of your results. There's just anything can happen. And then I guess in terms of understanding your options and planning, I think that's just making sure you get to have a time to sit down and review all those results with your provider and make sure that you're really clear on what your specific options are based on your results and your goals.
Yeah, no, I definitely agree with you. I feel like the support thing is huge, and whatever that is, or whatever that means to you, is definitely
Yeah.
going to be able to help you get through.
Yeah.
Okay, so our final question. What do you hope every patient understands about fertility testing and the many family building options available today?
I mean, I think that you want everybody to I mean, I think understanding the things that we've discussed in terms of like what is out there, what are the things you can test for, what are the things you can't test for. Um and knowing and an empowerment and feeling that you deserve an interpretation of your personal results as well as some personalized plan that helps you sort of achieve your goals. And again, like we say this all the time, but no two journeys are the same. And sort of, I think that again, just making sure that you kind of understand where you are and what you're trying to achieve and the best way to get there.
Awesome. Thank you so much, Dr. Brower and Yale,
Yeah,
for sharing your guys' expertise today. Did
my
you have something to
pleasure.
say, Yale?
Yeah, no, I just put in the chat
Okay.
my email address. And like I said, the Calendly above. And then if you're interested in a consult with Dr. Brower, um, please contact me. We can have our scheduling team reach out to you to see about insurance coverage and all those good things. But Dr. Brower is amazing. And I think the fact that those of you joining are getting able to actually hear straight from the doctor. I know when we started our journey, my husband and I really knew nothing about this field, especially when it came to a donor and surrogate. I thought they were the same person. And it's amazing, even consults that I have, with female intended parents that have never seen a doctor either. A lot of people don't know women are only born with a certain number of eggs, and just all the kind of steps that they can go through just to gather more information. So it's really important, to have these conversations. So we appreciate you also asking us to join.
Yeah. Yeah.
Yeah, thank you guys so much. And if anyone has any more questions, leave them in the chat now. I can move into our like live Q&A session if there's anything in here. I'll give everyone a second. Um, and we'll do our best to answer as many as possible. Let's see. I'm not seeing any yet, but I'll give everyone a second.
We were so thorough. We were so,
Really though?
Right.
everybody is so enlightened
Yeah.
that they are question free.
Yeah, yeah. I guess I have a question. What's your favorite part of your day at your job? Yeah,
My day or my job? I'm gonna do those separate. My favorite
yeah.
part of my day depends on the day. I like seeing my team every day. I like even when I just like get back from the vacation. I love all the people who wander the halls of this office. I love seeing Yale. I love seeing my nurses. I love seeing all these wonderful people who are so dedicated to the patient's goals. That's what's kind of
Mhm.
amazing is that you have a doctor, but like, my nurses keep a board of like all these babies up on the cupboards above their heads, and they have a
Yeah.
calendar with everybody's due dates on it. And, so, it's not just one person who in the office. So that's probably my favorite part generally of my day. And of my job, one of my favorite things is seeing the babies out in the world. I was telling
Aw.
these guys yesterday, I was at the farmer's market on Sunday and I saw not one but two,
Oh
two
my goodness.
families that I had helped build their families. And this one woman, I hadn't seen her since her baby was born, and she like from across the market, like she practically dropped her baby. She screamed, she ran, and that's like one of my favorite parts of my job is seeing my babies out in the world.
Oh, that's so sweet. I love that so much.
That's pretty great.
I don't see any other questions in the chat, so we'll move on. Thank you everyone again, and Dr. Brower and Yale for sharing your time, expertise, and your insights with us today. We hope everyone, is better understanding fertility testing and what your results may mean, and many family building options available today. Every fertility journey is unique, and having the right information is an important first step towards making confident decisions. So if you do have any additional questions or would like to learn more about your options, our team at ACRC Global is always here to help. And we'd be happy to connect you with Dr. Brower and Yale at Reproductive Partners Medical Group to discuss your individual situations. And thank you all again for spending some time with us today. We truly appreciate you being here. We wish you the very best on your family building journey. And have a wonderful day. And we hope to see you again at a future ACRC Global webinar. Thanks again, Yale and Dr. Brower.
Thanks,
All right. Thank
Madeline.
you.